Welcome to Health Professionals Outside the Box podcast. In this series, I'll be talking to health professionals who've leveraged their professional skills to pursue alternative income sources, alternative careers, and entrepreneurship. We will gain insight into their motivations, experiences, and challenges, and learn how we too can carve our own path to finding purpose, fulfillment, and financial freedom. I'm your host, Fee. Thank you for listening. Welcome back to this episode of the podcast. Joining me today is Mr. Jefter Chuma. He is a Managing Director of ICRIT Healthcare, an organization which provides care services to include domiciliary care, live-in care, and respite care. Jefter, welcome.
Thank you.
So tell us about your professional background.
Yeah, sure. I've got a long professional background. Yeah, I'm a mental health nurse, qualified mental health nurse. I've been qualified since 2002. And within that time, I worked in mental health clinical areas. Started in sort of forensic mental health, working with mental health offenders. Which I enjoyed. Then I moved on to more community-based type of mental health, where I worked in community mental health teams, early intervention teams. Again, that was really an eye-opener. I enjoyed every bit of it. But I've always been interested in research, particularly clinical research. So toward the later part of my clinical career, I moved towards clinical research. So I worked for Northwest clinical research team, doing some trials, drug-related, and again, that was good experience. I went on to work as a clinical research associate for Manchester University. Again, that was a really good experience. So, yeah, in brief, that's me.
Okay, that sounds interesting. So how did you then translate all of that into the current organization, ICRIT Healthcare? How did you get into it?
Oh God, that's an interesting question. I think if I say I don't know, you're going to say, what are you talking about? But it is like a natural stage of human development. Like, for instance, you grow so much clinically to a point where you feel you need something different. It's the same experience I had when I started nursery school. You sort of move on from being at home, then all of a sudden you're out there, you're playing. But then people would not ask you, how did you end up in nursery school or first year? It's because you have developed to a point where you need to be, to fit those shoes, if you like. So I've talked about my experience in the NHS, which spans nearly 20 years rather. Within that, you develop sort of an interest and you learn a lot. So I think one thing I've experienced within the NHS is when I joined, it was different. I was able to grow. They supported me. Then it got to a point toward the end of my career where the way I saw things was also different. I think the NHS at that point, in my opinion, was struggling. So we ended up having with a lot of off-sickness and obsession on targets. And so people I was working with were quite stressed, quite stretched. And that NHS didn't sit quite well with me. But again, I didn't want to just sit and continue to be stressed. So I decided to use my experience in starting something that is going to help other people. Within that, I think the first thing I did was to look at the things I enjoyed much in the NHS or in my clinical career. And I also looked at the things I didn't quite enjoy. So I developed this way of working, which encompass both experiences I've had, positive and negative. So the next thing was, okay, with all this experience, with all these interests, with the growth I've had over the years, what can I do with it? So it so happened that I went on holiday in Portugal with my wife and kids. And we just say, well, I mean, when we go back, the order was fine. I was not looking forward to going back to work. That was the first time I went on holiday and didn't want to go back to work. I said, okay, Dad, what could you do? I said, oh, well, if it was up to me, I'll start my own organization and do A, B, C, D. They said, well, why can you not? I said, well, then I had to ask myself the same question. Why can't I start my own organization and test myself and see what I think I know, if I really know what I think I know. So as you imagine, the organization I created, or we created, because at that point it was more than just me, is called ICRIT. But ICRIT is, we can call it an organization, but I call it a way of working. It basically stands for individualized care, reviews, innovation, and training. That's what it stands for.
Okay.
And that's what we do.
So if you can give just a brief explanation of what your services entail. As I mentioned before, it says you provide respite, live-in care, and domiciliary care.
Yeah. Yes, I think, yes, we started off with home care, which is basically, for a better term, an alternative to nursing home admission. So the theory behind it was generally people need choices, whether to stay at home and be looked after at home or move on and be looked after in a nursing home. So we picked that first because my wife has got experience in dementia, end of life, and generally in working with old adults. But also, she believes that people should always be given the choice in terms of where they want to be cared for. So basically that's what we do. We have a team of people who go and support older adults and people with learning disabilities, people with mental health problems who are otherwise maybe vulnerable in some ways. So they go and help them to be as independent as possible. So that, in a nutshell, that's what home care is.
Did you take on any additional qualifications prior to you starting the organization?
Yeah, well, I don't know whether to call them additional, but I think one thing I've always had as a clinician was I was always on top of my clinical and professional development. So I started off with a BSc in mental health. I ended up doing qualifications in cognitive behavior therapy. Then I ended up with a master's degree in health and social care. So then I did a leadership course. That was all through when I was developing my clinical experience or expertise. So therefore, by the time I thought I was ready, I was actually ready. I didn't need any more training.
Sure. So just going back then to the organization, it sounds like you have you have diverse clients. How do you attract them?
I think it is based on our way of working. I think one of my clinical interests is, in fact, I've got a publication on clinical leadership and clinical decision making.
Okay.
So it is what we put into the input we put in preparing our staff. So therefore, when we are recruiting, we always try to look for something we don't have, like someone with special skills. These are special in my opinion. Like last time, we're looking for someone who is extremely good at cleaning, who has done cleaning all their life. That sort of element was what was lacking in our organization. So the emphasis, like I said, from the name, we emphasize on individualized care. But individualized care, in our sense, is knowing people as individuals. That includes the people we support and our staff. So therefore, with that theory, that helps you to provide sort of the optimum support to the people. So, for example, we started mainly with just elderly people who were not able to help themselves anymore. But if you do a good job with that, you get a referral of someone who is slightly more complex. Then you do your best in that, you get another one. So it basically grew from doing things right from the word go. So once you do your best, obviously the referrals you get are from the family themselves. They may know someone, one of their relatives or friend who may need the same kind of care. And the same family, they are under a social worker or mental health team or some other professionals. So it is through that professionals, families know what you can provide.
Oh,
And
I see.
yeah, so therefore it becomes diverse because the skills we have within our team are quite diverse, and we actually deliberately look out for that. And B, whatever we do, we try to do our best and get the best results, which is actually helped us to grow.
Do you also get any referrals from local authorities?
We do, yes. I would say at the moment, 90% of our referrals are from local authorities. Yes.
Okay.
Prior, I mean, we've only sort of gone on to what they call the framework providers, which means we have a contract with the local authority and they refer the clients through that contractual agreement. But prior to that, we didn't have it. We're getting referrals from what they call direct payments, like from families themselves. They've got a budget with which they can use to source care. So that's how we started. But then we were so good that the council decided to put us on what they called spot purchase. So although we were not on the framework, they would still contact us and give us clients they felt needed our input. Yeah. So yes, you're right. We are getting 90% of our referrals from the local authority.
Is there like a criteria or standard that they measure your service against? So when you approach local authorities, do they expect you to meet a certain criteria?
Yes, I think it is like everything. Like, for instance, if you are applying for a job, they expect you to meet the minimum requirements.
Mm.
Yeah, so with this, they expect you to be registered with CQC. They expect you to have a good rating with CQC. And also, I think they advertise the tender, you apply for it, then they evaluate the answers, and you either are given the contract or not, based on how you would have sold yourself.
And do you try to exceed those standards, or do you think it's enough to just meet them?
No, no. Well, I mean, those standards are sort of important. Um, the but our way of working is we meet those standards by being ourselves. So we don't deliberately sort of say we've got to do this because CQC is asking us to do this, but we do things because they are the evidence. They are the We do it because it's evidence practice. It's evidence-based practice. With my experience in research, we are almost always on top of current research and improve ourselves. So there are times when we feel we are actually ahead of what CQC or local authority expect us to do because of, yeah, it's, yeah, we know, I mean, good standard or good care is good care, whether it is being evaluated by CQC, local authority, or by ourselves. So the emphasis is to provide the best we can. And usually the best we can, or at the moment, the best we are providing is good enough or exceeding expectations for local authority and CQC.
I guess it keeps you ahead of the game, because from what I understand, home health care is a competitive field. Is that right?
It is right. Yes, it is. Well, I think I'm going to say it's not right.
No. Okay, that's
Yeah.
fine. Yeah.
No, I think that's what people choose to do, or people do put labels on everything. But the truth is, life is competitive, full stop. I think everything you do in life is competitive. You have to apply yourself. You have to give it your very best. So I think there's the perception that home care business is easy. Therefore, there are a lot of providers who actually come in because they perceive it as an easy thing. So when they come in, they are surprised because it's not easier than any other thing. It's equally competitive to the things they are running away from. Oh, so therefore, um, my belief is it is as challenging, as competitive as any clinical practice or any walk of life, or even as raising children.
But how do you maintain that sort of, unique selling point, which stands out from some of your competitors?
I think by being ourselves, I think one of the things we have been able to do, like for instance, is to value our staff. So our staff, they do have ownership of the organization. They feel they actually protect the organization. They know the organization is theirs. So we got there through giving everybody a chance. So there are people who thought they will never be able to work in health and social care, either because they are dyslexic, or maybe their English is not the best, or they feel they just don't have the confidence. So we got people from all walks of life, and provided them the training, the support, made them welcome. So what then tends to happen, or what is happening, is a lot of the staff we started with, we were able to retain, and they grew in confidence more than anything else. So you make people to be themselves and to work at their very best and to really enjoy the work. So I think by doing that, naturally, they guard or against any bad practice, or they really give their 100%.
I understand that sometimes finding and retaining staff is one of the biggest challenges facing the health and social care sector. So how do you ensure that, especially now with COVID, actually, because the nature of the job entails close personal contact with, individuals, with the person that they are supporting, which carries an increased risk of COVID-19 exposure. How do you ensure that maybe that you are continuing to reach and maintain high productivity levels and job satisfaction amongst the employees?
The key is our ICRIT way of working.
Okay.
So it's knowing all our staff as individuals. That includes to know whether they've got a dog, they live with their mom who is not well, they've got families in Afghanistan they are supporting. You know people to a point where even the shift pattern can revolve against them. There are people who can start work at 9, and some can be specific. They can only start work at 13 past 9. Some can just work between school dropping hours. Some can do teas and beds. Some don't work Saturdays and what have you. So once you know those staff dynamics and consolidate them and really understand that people need to have this life outside work, and you make their life outside work.
That's true.
And so when they come to work, they know they are not exactly pushed. They do the hours they are able to do. And if they want to do more, there is room for them to do more. But more so, what we found is our staff became like a family. They work for each other. They really communicate, they swap shifts. Managing them makes it a lot easier. So that's on staff retention. Like, for instance, I touched on that we gave everybody a chance, but then we invested heavily on training them and making them as competent as they can be. So therefore, people do appreciate the support you give them in terms of training, mentorship. They appreciate the flexibility you are able to give them. They appreciate you knowing them as individuals. And that makes them part of you or part of the organization. So I know there are people who actually who feels ICRIT belongs to them more than it belongs to the directors, to me, or other people, because it is in their blood. So therefore, coming back to the COVID period, yes, like every other organization, we got affected, but people rallied behind it, did extra. The people some people went off sick, which is fair enough, but some people, a good number, were able to stay fit, and they did over and above they were expected to do, and everybody chipped in, from the admin, registered managers. People just went in. Everyone during COVID was a carer, and everyone was just supporting each other. So recruitment-wise, such good habits or that way of working, you cannot hide it. So other people will get to know about it. So other people will be recommended to come and join you because they know they will receive the same kind of support. So we have not exactly struggled to recruit. But again, our recruitment is not, it's not about the numbers with us. It's about the quality. So we don't take more clients when we don't have enough staff, or our staff are still doing training. So we work at a very steady pace and get staff, give them time to settle before we can take more packages. So that way, some business analysts will say, well, it's affecting your growth. But I don't think so. I think it allows us to provide the best care.
No, definitely sounds like you've invested heavily on the staff, and I guess it encourages them or motivates them to become more committed to their role and committed to the work, the care that they provide, as well as respect for the organization as well.
Yeah, I think what we found is that's what actually helps with person-centered care or individualized care. So people can only treat the people they look after the way they are treated. So the tendency now is when our carers go to support people, they know that they need to be addressed by name. We need to know about their past history. We need to know about their interests. We need to talk to them. So they do what they appreciate in their life. So they pass it on to the people they look after. So, which is another concept which I found really interesting, because when we get packages, they are very, very prescriptive, if you want a better word. They tell you that, okay, you do, with person A, you do 20 minutes, you give medication. After medication, you do personal care and all that kind of stuff. It's very prescriptive. But what we found is, so once you know them a bit better, the care becomes more individualized. It becomes what they want rather than what is prescribed to them. And that's actually what improves the quality of care you give them. Because really, it's not about just going in, take medication out of its box and give it and you're out. It's about knowing that Miss Smith likes a cup of tea. This is how she likes it. She reads the newspaper. So it's things like that makes the job more personal. My staff enjoy it.
How do you then monitor the quality of the care that's delivered by the caregivers, especially since they go into different settings? Do you have patient feedback or?
Yeah, we do. I think that's one, again, that's our way of working. We do audits because naturally we want to know that the quality of care we give is good. So from the audits, we get like lessons learned from, we pick some errors, we pick some mistakes, we put a program together and try to correct them. We do spot checks where our managers, team leaders, just visit a carer unannounced, just observe them doing care, their interaction with families and what have you. We, like in other organization, we get complaints and compliments. So once we get a complaint, we investigate, we take it really serious. Again, from that, there is lessons learned, things we can do better, things we need to support our staff to do better. And we've got that kind of open mind. We do surveys. So we send out surveys to people we support, to professionals, and to visitors. So we sort of collate all that information. And the aim, again, is to improve the practice. And we also do get safeguarding issues. When from those, again, we have lessons learned. We put a plan, a management plan to make sure that it will not happen again, or if it did, reduce the impact that particular incident would have had. Yeah.
Okay.
So yeah, we do a lot of things. And again, during supervisions, there is there is a section where we talk about lessons learned that sort of helps people to develop a culture of, I call it defendable practice as opposed to defensive practice. So instead of people who trying to cover their back, they come out a bit more and try to defend what they're doing and try to have evidence for what they're doing and be supported to grow in what they are doing. But again, toward the end of my NHS, the term covering my back or became like a big thing. So we are not about covering our backs, but we want more defendable practice rather.
It shouldn't be like that. Otherwise, it makes people anxious, isn't it? If you're always thinking of covering your back, I mean,
that's true. I think there are a lot of things enough that can kind of make you anxious. Like, for instance, in a new environment, you're in someone else's home, and some of the houses do have cameras. You feel you're being watched, and I think it can make you feel uncomfortable. But again, if you know you're doing the right thing, you're doing the best you can actually be proud that people are watching me doing the best.
I guess so. You wouldn't mind. You wouldn't mind at all.
Yeah. So it is. So it is worth investing in that kind of culture. That's our experience.
So for someone looking to start a similar organization, what do you think would be the costs that you think they need to be aware of, like the main costs associated with starting and running a similar organization, a home healthcare service?
Again, I think people, when they are talking in terms of costs, it tends to be financial, like put a figure in terms of how much do you need for that. But I think they need to have the right attitude and go in it for the right reason. So in our case, I mean, we did invest heavily on financial wise. I mean, already there was the experience I've got, the experience my wife has got. And so it's about using what we have to the very maximum. Like in our case, I've got a friend who is obsessed with qualities. He did project management. So it's about using those contacts as your capital. Because in my case, I provided the training. My friend helped with quality assurance, helped with some sort of understanding background research on CQC, what we need to register and things like that. Then my wife brought all that experience. So therefore, sometimes unless if you are a millionaire or if you've got a lot of money, then you can just invest hugely and pay people who did what I did or what my friend Innocent did or what my wife did. So it's hard to put money on it because it's about, like I said, a stage of human development.
Of course.
You are either ready for it or you are either or not.
Yeah.
I have actually grown to fit those shoes. That's my advice. I know that might not be very helpful, but
no, it does. I know sometimes people have different sources of funding or finance to help them meet the initial costs. Were you still working, or had you put aside amount of money that you?
Yes, I was working for the first sort of 2 years of setting up the business. I think what I did, we invested a lot in sort of knowing what we have between or among us. Then we employed an admin person who was doing supporting, doing operational duties.
Okay.
So me and my wife, working full time, part of our salary would go into paying the admin person. Then when we got our first contract, we employed 2 people to service that contract. And again, we're paying them from our our salaries. Then things just developed from then. 2 years on, I didn't have capacity to continue working anymore. My wife didn't have capacity to continue working. So we were needed in the business more than in clinical areas. Okay. So that's how we did it. Oh. But again, significantly, it was not exactly the money we paid the admin, the money we paid the first two carers we had, but it was everything else.
Okay. What are your responsibilities as a director?
I think I've talked about it. I think it is developing a way of working, developing the organization culture, helping the organization to grow, fostering relationship with commissioners, other providers. So it is sort of, you can say it is never that specific, because sometimes the role changes quickly depending on where the emphasis is or where the direction you need to take in that particular time.
What is the most important thing that you have learned about leadership?
About leadership, I think I would say the same things I learned through my clinical career, that leadership is about helping other people during their growth and development. And also developing like a way of working, or a pathway, or a theory, or something that actually people can relate to and follow. Like in our case, this individualized way of looking at people and the effort we did in developing that. What it meant is it improved the quality of work we give, but it also improve the people's, our employees' quality of life. So as long as you are able to get that balance and probably humble yourself a bit more, it's that's one thing I continue to develop. I'm continuing to learn. Significantly, I think one of the things one of my weaknesses, it's probably one of the biggest weaknesses I have, is I don't usually apply brakes. I don't have, so I always go full on whatever I want to do. But with maturity and being in the business, I'm learning to sort of apply a bit of brakes, and maybe walk away from maybe some things, some challenges, go away, reevaluate, then come back again. That way, yeah. But I also learned to that for me to be effective, I need to manage my personal life better. So I spend quite a lot of time. I'm always at home every weekend. I spend a lot more time with family than I used to do as a clinician. I've started playing golf again. So it's about sort of getting the balance to look after your mental health, doing things that you enjoy, as well as coming back to lead people to do the things we are all out to do.
That's true, because if you're not really taking care of other facets in your life, how can you become an effective leader? So I think the things that you've mentioned are great. Is there anything you would have done differently, or are there challenges that you would advise people just to be aware of when going into this business?
I think differently, maybe I wish if I had realized that I've grown into the person I was earlier. So I would have started the business earlier. I think I was probably 3-4 years late in starting the business because, what I can advise other people again is you don't go into a business because your friend Jeff is doing the business. You do it because you feel you've grown into into having the skills or the capital to do it. Because if you just go in like I said, saying, well, domiciliary care is easy, you'll be surprised. It's not easy. You need, like anything else in your life, you need to work harder. So I don't think it's easy. No.
Well, thank you so much, and very interesting talking to you. Where can people sort of find you if they wanted to ask some questions, if they're looking to take a similar path to you?
Well, I don't think we are difficult to find. I think we are on social media. We are on Facebook. We are on LinkedIn. My telephone details are on LinkedIn. I think naturally what we found is I don't know how people are finding me, but they are always able to find me because I'm providing mentorship to a few startup people who are starting business. So they get my number. I don't know from where they ring me. They come, we sit down, we talk. And I've been doing that for the past 2 years. We are heavily involved in other sort of things, which makes us a little bit more visible. Like ICRIT is the main sponsor for a golf society in the Northwest.
Oh, really? Okay.
Yeah, it's called Savannah Golf Society. So again, the theories or the way that golf society was developed relates more to what we do. Like it is to support young people into doing sports and taking them away from bad things and mentor them to doing business, training courses. So it's about getting the young people in a golf field and just talk about their future and encourage them to move on. And by actually sponsoring that, you get people to then kind of ask, who is ICRIT? What do they do?
I see.
Yeah, and that's how we sort of so sometimes I sort of ask, do I still want to be found? Because sometimes the phone calls, the inquiries,
they won't end.
I wish if I had enough money to a personal assistant would just take calls. But I don't I need a personal relationship to everyone who contacts me.
Well, I think that's reflective of your leadership skills, I guess, and the organization, all the stuff that work for the organization. Well, thank you very much, Jeff, and I appreciate you coming to share your time with us today.
Okay, thank you. My pleasure.
Thank you for listening to this episode. If you like the podcast, please subscribe, rate it, and review it on iTunes, as this can help others find it. If you'd like updates on the podcast, you can follow the pages on Instagram or Facebook by searching for Well Restorer. If you have any questions or would like to give some feedback, you can send an email to info@wellrestorer.co.uk. Thanks once again. Take care.